Can I talk to you for a second?
Yes, doctor.
So I just talked to the family about Margie's death. Do you mind talking to them about organ donation?
Oh yeah, sure.
Okay, thank you.
No problem.
I just overheard. Given their cultural group, an organ donation is never going to happen. Don't even bother asking.
Hey, that's an unfair comment.
Oh, pish posh, hon. I've been dealing with that cultural group for years. Never got a donation out of them.
I guess you're right.
Hey Hector, I heard you need another towel?
Oh yeah, thank you. Hey, did you hear Christina talking about that comment?
What did she say?
She's like, don't ask them about organ donation. What a bitch.
What an asshole.
I know.
God, who says that?
I know.
Can I talk to you for a second?
Oh yes, doctor.
So I talked to Margie's family about her death. Do you mind talking to them about organ donation?
Oh yeah, sure.
I just overheard. Given their cultural
Hey,
group.
can we talk over there, please? Family could hear us.
Well, what I was saying was, given their cultural groups, they don't believe in organ donation, so I wouldn't even bother asking.
That's an unfair comment.
Oh, pish posh, I've been dealing with that cultural group for years. Never gotten a donation out of them.
Yeah, but all of our past experiences have indicated that that particular culture group doesn't donate. Maybe this particular family does believe in organ donation, so I think we should give them a choice.
Well, it's your time you're wasting.
It's okay.
Hey, alright, I need to talk to the family, preferably now. Alright, good, alright, so Maggie's dead, so we need to get her organs out of there as soon as possible for other patients, you know,
What are you
survival.
talking about? She's so warm. How can you even be saying such things?
Listen,
Is there not a
I
time and place for this?
got a busy shift, alright? So the sooner we get this done, the sooner I can go on to my other patients, okay?
So is she really dead? I mean, she's still breathing. What's the difference between brain dead and being actually dead?
There's no difference. She's dead. She's dead as a doornail.
Look, I don't care what kind of death she is. We're not cutting up my girlfriend.
Oh, calm down. It's not even that bad. I mean, all we do is cut her in half, take her organs out, then sew her back together. She's
Why, she's
dead.
so
She won't feel it.
I don't care. We're not doing this.
Okay, so couldn't she just be in coma or unconscious?
No, because of her cerebral hemorrhage, which caused excessive bleeding, which caused lack of oxygenation to the brain tissue, causing necrosis, which essentially meant that her brain died. And don't worry about it. We ran tons
Okay,
of ECG
I have a
tests.
question. If we actually wanted to do organ donation, how would we do it?
Well, you
We
guys.
said we can't be entertained.
Well, you guys sign a couple forms. We take her on down to the basement. We cut her open, empty her out like a Christmas present, and then we put her back together.
We're not doing this.
We could look at.
We're not doing this.
Okay. The decision's between you two. I need to go get a coffee.
I
So
hope you choke on that sandwich.
I'll talk to you guys in 5. We need the bed in 10. Okay? Bed in 10. Perfect.
I know my mother was a good woman, and she's at a better place now, so that makes me feel better.
Lisa, we're not doing this. I don't want to see my girlfriend cut up.
Can we talk about this? I need a little bit of time.
Hi guys. My name is Claire. I was the attending nurse for Maggie.
I'm Ted.
So we do have some things to discuss about Maggie. So when you guys are ready, come find me at the nursing station. But you know, take as much time as you need. I'll just be outside the hall. Okay. Come on in, guys. All right. First off, I'd like to thank you guys for taking the time to talk to me. We're here to discuss the possibilities of organ donation.
Are you serious?
Yes. Pretty frustrated. I understand your loss. I'm very sorry for your loss, but we only have a very small window for these
Okay,
organs to be
I have a
viable.
question. She's still breathing. What's the difference between dead and brain dead? She could still be alive.
So you're confused between the difference between whether she's brain dead or dead?
Yeah.
I understand that it's very difficult to comprehend watching your mother's chest rise and fall and thinking that she's still alive and then having someone pronounce her dead. Unfortunately, the reason why her chest is rising and falling is because we have her on a ventilator and we have her on these machines so that her organs can remain viable.
Look, I don't care what kind of dead she is, we're not doing this.
So she could be unconscious or in coma.
So you're wanting to understand the difference between death or brain dead and whether or not she's in a coma? Those are two different things. Coma, she would insinuate that she has some sort of brain activity, whereas brain death, it has been pronounced through a series of tests that she has no brain activity.
We're not gonna
Could
do
you
this.
please sit down? Could you please sit down?
Look, this is all your fault. If you had made us bought that house, we wouldn't be in this situation right now. So it's downstairs.
Okay. If we were to go about to do that organ donation, what would be the procedure?
Procedure would be after giving you guys some time to grieve and saying the proper goodbyes, we would be bringing her downstairs.
We're not doing this.
Where there's a transplant team waiting to remove the organs that she has selected to be donated and taken away. Ted, if it makes you more comfortable, you can have a seat.
Lisa, how can you even entertain this thought?
Okay, I know my mother was a good woman, and I know she's in a better place now. She's in God's hands. And if we have a hopeless situation right now. If this helps another family, I'm sure my mother would agree with that.
You know, giving hope in life to another family is the most altruistic gift that you can do.
We are not giving Margie's organs to some random person. We're just not doing that.
Ted, I understand that you're frustrated, and I'm really sorry that I'm upsetting you right now. But Maggie's organ donation, I mean, that's a family decision, and you guys need to make that decision. So if you guys would like to take this time to discuss amongst yourselves as to the option.
We need to talk to her just for.
Alright, I'm going to be leaving these forms behind. These are the organ donation forms. If you guys do consent to it, feel free to fill them out. If not, leave it. You can leave the room, go back to Maggie's room if you'd like. Alright, so the options are here. I'm going to be outside if you guys have any further questions.
Thanks.
Hi, my name is Bo. I'll be covering the concepts covered in our both positive and negative scenes by the characters of Ted and Lisa. So, throughout the scenes, Ted was displaying a really aggressive behavior through his tone and his postures. These were both in verbal and non-verbal display of his aggression. He was using a really high-pitched tone. Sometimes he was yelling, and his body structure was, he just seemed mad. And according to his stress level, I would classify Ted to be as a high stress in a situational stress. This because it is an unpredictable moment in his life in which his mother passed away, and his way of coping with the stress was blaming and projecting it onto something else. For example, he was blaming Lisa of buying the house with the stairs, and as for Lisa, her stress level was she was in a moderate stress level. Similarly to Ted, she was in a situational stress in which her mother passed away, unpredictable, uncontrollable, and nothing could have stopped it. And in the part where she referred that her mom was in good hands and was in a better place, she displayed the McCuban's resiliency model of transcendent and spiritual beliefs that allow connecting with larger purpose. And what I got from this project was this situation predisposed me to the things that I will be facing as a nurse, and it will be a good practice and learning experience and I learned a lot from it, and it will greatly help me as a nurse in the future.
Okay, so this is the discussion for scene 1 for our vignette. My name is Ekta and I played attending nurse for scene 1.
And I'm Christiane. I played the senior nurse for a scene 1. And the first half of that scene, we showed the improper way of dealing with a conflict.
Yeah, you came into my room where the patient's family was still there and you were stereotyping towards them.
I was also being really patriarchal. It was the whole, I know better than you do, so do what I say. And yeah, I was just plain old being rude.
Yeah, you were also using these non-verbal gestures, which were really intimidating, so I wanted to avoid that whole situation. I didn't want to deal with you or make eye contact, so I turned around, I mumbled a few words. Although I called you out on it, I was still being really accommodating, so at the end I agreed with what you said and avoided the whole conflict altogether.
Yeah, it was good that you stood up, but you really didn't have the non-verbal to back up that verbal statement.
Exactly, so it was a lose-win situation for me.
And it was a sucky situation, but I also understood why we wrote it like that. Before starting the nursing program, I definitely would have avoided or accommodated to the senior nurse because she's a senior nurse, she knows what she's doing.
Yeah, I probably would have done the same, but I guess now after learning all these concepts, we kind of know how to deal with that kind of situation. We know how to advocate for our patients, so I know next time a nurse like you would come around, I know I would be assertive, I would be able to face that nurse in a accurate, professional manner.
And you showed that really well in the second half of the scene.
Yeah, so I called you outside in an area where the patient's family couldn't hear us, and I called you out on your behavior. I told you that it was a very, it wasn't a proper way to.
It was rude.
It was really rude, yeah. And yeah, you were still being patronizing, but although we didn't resolve our conflict, but I was able to take out my feelings, so yeah.
So you did stand up for your patient, you were assertive, you used the I statements, and you did tell me that what I was doing was wrong, and I wasn't having any of that, so like you said, I was still being patronizing, and I just didn't care, and sometimes that's gonna happen.
Yeah, sometimes the issues are not going to get resolved, and in that case, we always have our HR department to depend on.
So now we know.
Now you know.
Right, so I was the nurse in both the negative and positive scene for scene 2. So I'm going to emphasize the concepts that were covered in the negative scene of scene 2. So initially I start off the video with eating in front of the patients, so that would be that's clearly indicating that I'm not ready to be professional, I'm not present or ready to be empathetic or even a nurse at that point. I don't give the family any time to grieve. I come in abruptly, no timing, tell them that I'd like to do it now, which is just inappropriate. And then I also, in the first lines of dialogue, I used inappropriate use of humor. So I am making a joke about being auctioning off her organs, which naturally Ted responds with a very hostile response. So also throughout the video, I try to show as much as possible an improper use of proxemics, which was difficult to do considering the shot could only cover so much distance. But I wasn't open to any comments. I wasn't trying to show that I was willing to be there with them. So then I also continue on to be very dismissive. So when Lisa was asking me a question about her mother and the difference between death, brain death, coma, unconsciousness, I was being very dismissive, dead as a doornail. Also when she asked the question about unconsciousness and coma, I also use a lot of medical jargon, which is inappropriate because obviously they won't be able to follow that. Also, my dealing with Ted as he was going through stress, probably about moderate stress level, wasn't being empathetic to him. I wasn't trying to diffuse the situation. I wasn't trying to recognize any of their emotions. So throughout the video, I was trying to show my nonverbal positioning was, no eye contact, rude, exasperated. My tone wasn't empathetic. I was eating. Towards the end, I just kind of talked about going to get a coffee, like I could really care less, which is very inappropriate. I was also coming across as very sidetracked, obviously, because I was keep on thinking about other patients, and yeah, so basically I didn't develop any kind of trust with the patient. I didn't give them any proper information that could help them make their decision, to the point where they most likely made the decision of not giving the organs, which doesn't help anyone. So overall, I mean, with reflection of this scene, I see that, personally I would want to be a bit more empathetic, obviously, but it gives a good black and white contrast to what's appropriate to do with someone who's going through that loss, and like small things with how you are with those people goes a long way during that time and process. So that concludes concepts covered in scene 2, negative scene 2.
Hi, I'm Carissa, and I'm going to go over some of the concepts that we used in our second scene, the positive scene. So the good nurse in this scene used a lot of reflection, listening responses, and clarification with Lisa to make sure that she was understanding what Lisa was saying, also to help Lisa get in tune with what she was feeling. So a lot of reflection going on. She used a lot of open body language. She was calm, empathetic, and she was very informative so that she could build trust with the both of them. She didn't get aggressive with Ted when he started to act aggressive, but in fact she started to use a lot of assertive language. She was calm, spoke slowly and calmly, didn't use any sudden movements to get him all riled up, and talked really slow. She was very assertive with him, and when he started to get off track, she brought him back to focus on what they were discussing there. She was also very reassuring with Lisa and with Ted when he was upset that maybe that Margie's body might be cut open. She was reassuring and let him know that no such thing, that she wouldn't be cut up to the point where she wasn't even recognizable. Try to be empathetic towards what he might be feeling, and she used a lot of simple language. As opposed to the other nurse who used a lot of medical jargon and made it incomprehensible. And then towards the end, she let them know that organ donation was a choice, that they weren't being forced to make one decision or the other. And I think that's important for any nurse or healthcare professional to do. So yeah, a lot of the key points was just the tone, the body language, being empathetic. I think for a situation such as this, those things are very important. Yep, and that's it. And also, I think a lot of the body language and verbiage that she used in the situation was important because it was a sensitive issue, but just in regular nursing practice, I think it's important to incorporate care and just that empathetic language and tone, and that's something that I would do or that's what I would take away from this situation, is just being more aware and more I guess just aware of the body language that we use and the tone and pitch and things like that are important to nursing practice and caring for patients.